Today, we're talking to Representative Herod of Colorado. Representative Herod was elected in 2016 as the first LGBTQ plus African American in the Colorado General Assembly, while receiving the highest number of votes of any candidate running in contested election. Representative Herod has given multiple TED Talks, and today we've chosen to watch her 10-minute TED Talk from December 2020, which is titled, "What if mental health workers responded in emergency calls?" We're going to follow this up with a Q&A live with Representative Herod herself. Now let's play that clip. Wow, that was great. We are going to start by asking Representative Herod a few questions we put together beforehand, but we will specifically designate time at the end of the webinar to answer your questions. If you have questions, please type them in the Q&A box located on the taskbar at the bottom of your screen. If you have comments you'd like to share with the group, you can use the chat function also located on the bottom of your screen. Representative Herod has sponsored legislation to re-enfranchise voters with felony convictions, enhance law enforcement transparency and accountability, and advocates for civil rights. Additionally, she championed the Caring for Denver ballot initiative, which raises $35 million annually for mental health and substance abuse treatment. Representative Herod, thank you so much for joining us today.
Well, thanks so much for having me.
So we're going to start by asking you a few questions. To begin, how do you feel your identity as a woman, a person of color, and part of the LGBTQ plus community have impacted your work as a mental health advocate?
Well, it absolutely has impacted my work because I think I see, firsthand the intersectionality and the lack of resources for folks who are, quite frankly, like me. And honestly, it was really interesting because when I came into work around mental health issues, I thought it was something that wasn't spoken of for people of color, especially Black communities. And that it was something that we faced as challenges in disproportionate levels than our white counterparts. Basically, I thought if you were white and wealthy, you didn't have to worry about these mental health challenges. My sister has been in and out of the criminal justice system for about 30 years, specifically because of mental health and substance use. It triggered from trauma, sexual trauma that she experienced when she was much younger and never was able to have a conversation about it or work through those issues. And so I saw firsthand how my family struggled with these issues. But I honestly got to tell you, I thought if you were white and wealthy, those things went away or they didn't exist. And you could go to more than 5 therapy sessions and actually, work through some of your issues. And then I went into the Ritter administration with Governor Ritter, who was a former governor of Colorado. First Lady Jeannie Ritter really wanted to focus on mental health and substance use. It was her passion and still continues to be. She is such a great champion. So she pulled me in to start working with her on those issues. And I quickly realized that all of us experience challenges, be it personally, in our families, definitely in our communities, but it's much closer to every single one of us than we know. And that, quite frankly, mental health and substance misuse, it is colorblind, but access to resources is not. And so I got into the work to make sure that we increase resources, not only for folks who look like me, but for everyone. And making sure, though, that we aren't not reaching people like me or the hardest to reach or any of that, and making sure that we truly have inclusive and accessible mental health and substance misuse supports. And so that's really how my work influences me, both being a woman of color, a queer woman of color, but also as someone who is family member and family and myself struggles with these issues and would like to see more resources for us all.
Absolutely. Your personal experience and the impact is just incredible. And you were a prime sponsor for a bill recently, which requires law enforcement agencies to issue body-worn cameras to their officers starting in 2023. And how do you think this will impact people who are experiencing a mental health crisis?
Well, unfortunately, we've already seen some of this. Recently, we had an elderly woman who was struggling with mental health challenges, and walked out of a store with, I think, $12 worth of goods, and was assaulted by the police in a really harmful way. She was a white woman. And when the body camera footage was finally released and went viral, that was the only time we saw not only accountability for those officers, which I think is really important, but agency-wide training around some of our seniors and elders who need different types of support and maybe struggling with mental health challenges, schizophrenia, dementia, and other things. And how law enforcement should interact with those folks and not use excessive force in those situations, and how it just escalates everything. We also saw it with Elijah McClain in Aurora, where Elijah was not diagnosed with a severe mental illness or any type of mental illness, but just in the way that he responded, that tactile interaction with the police and the close encounter is really what escalated it in his mind, and ultimately led to his death, even though he was not suspected of any type of crime. And so, we see it all the time. And the body camera footage was one piece of a much larger bill around police accountability. But that footage really helps us to understand why the response is happening in the way that the response is, where training is necessary, but also where we need to remove officers who choose to escalate as opposed to de-escalate and really get a sense of the situation. And as you saw with the talk I just gave about STAR, there is a different approach.
Absolutely. And we know that when you were a prime sponsor of this bill, that kind of came out of, happened very quickly after the murder of George Floyd. Can you talk a little bit about how that influenced your actions and with that legislation?
Absolutely. So for decades, generations, but definitely in the past 10 years, we have seen an increase through social media of people of color, specifically Black men, being murdered by law enforcement. And in some cases, you may call it justifiable. In other cases, it's definitely not. But in all cases, you think that there could be a better outcome. What if that person had services before they got to the situation, the victim or survivor? What if law enforcement had access to mental health care for their own trauma that they go through? Would they have responded differently? Is there a way to really look at public safety that actually decreases harm in the community, And so when George Floyd happened, we were in the middle of COVID, and I was trying to avoid looking at my phone. I didn't want to see the video. And eventually I did, and I was like, it's time. As a legislator now, I'm not only going to go protest about it, I could actually do something about it. I can write a law about it. And so in the first days of coming back from a suspended session from COVID, I went outside to join a protest. It was like, very small, new, maybe 100 people, first days, just to listen and to see what people were talking about and what the solutions were. And I got shot at. Some agitator shot at me and the crowd, and I was rushed back into the building. My colleague said, "What can we do? How can we help you?" And I was like, "I don't know that I want just your platitudes. I want a bill. I want to really address law enforcement accountability in this state. I don't want to go around the edges. We have to be direct and put in place the policies that we know work." Now, to be clear, the bill that I passed had almost zero new ideas. It went quickly. All of our bills during that COVID session did, but they weren't novel ideas. Wearing body cameras is not new, but it was an omnibus bill, it was a comprehensive bill. And it wasn't something where we gave an option, right? It's a mandate now, because we know we need this footage. We know we need this information. And we know that if officers act wrongly, we need to hold them accountable and not just let them shop from, one place to the next place to the next place and be officers in other counties, which is also just as dangerous. And so that's what we did. But it's not the only thing we did. During that summer, we had STAR on the ground already. I work with law enforcement very frequently about, how we can respond differently and what accountability can look like, but also what training is needed. We have now trained all Denver police and fire with crisis intervention training, because sometimes fire is first on scene. We've trained our 911 dispatch to respond differently to mental health calls and to identify them. These are things that are really important, because what we have done wrong in Colorado and across this country is we have criminalized mental health and substance misuse challenges. And that is not okay. The fact that you could be considered a criminal for maybe lashing out or thrashing about, and hitting maybe a first responder while you're in crisis, trying to harm yourself, with no other crime associated with it, tells you that there's a problem, right? Like that people don't understand the situation that you're in. They don't understand how to get you help. And instead, it could end in really violent and deadly consequences. And that's something that we're trying to change. Another bill that I passed this year was to ban the use or to limit the use of ketamine in the field, because we're finding that officers are directing paramedics to inject someone with ketamine if they have this thing that they're calling excited delirium or extreme agitation, which we know is another form of justifying force against those who are in a mental health crisis. And it's something that we cannot allow. And so we passed that bill this year as well to really decrease those instances, because ketamine is killing people, especially those who have substances or who have been called in for substances. But the thing that bothers me the most, and I don't know if it should, but it does, is that the last few instances of murder by ketamine, a family member has called to help, called the 911 to help their son or their daughter to help to stabilize them. And instead they injected them with ketamine and they died, I mean, we have got to be better as a society, and not only, prevention, but also intervention, postvention, getting people the help that they need and the response that's appropriate, the appropriate response for what's going on scene.
Absolutely. And it sounds like the Denver Star program, which, was inspired by the program in Eugene, is really helping with that. And in Wisconsin, we've seen a few similar models that have taken root recently, which is fantastic. And we wanted to ask how you feel that programs like STAR and Caring for Denver increase mental health access to marginalized communities.
Now, the thing that I thought, really important, when I went to Eugene, I saw a program that worked, and you heard the story. It really changed my entire perspective of how we think about public safety, because I saw it right before my eyes. I also went to, what I thought was also interesting was that there was more of a network of mental health support. So there was somewhere to take people to, right? There was a response. There was services available even if you didn't know how to get them, the Cahoots person did. And so I think it's really important that we think of these types of programs not as a panacea or a end all be all, but more of a part of a network of solutions, a network of care. And so that's why I ran the ballot measure Caring for Denver, and now have the Caring for Denver Foundation, which is the largest mental health foundation likely in the country, that is looking to really change the way Denver does mental health and substance misuse supports. Because just because we have STAR doesn't mean we have somewhere to take someone to, and people need that support. And like I mentioned a lot, because I just remember so vividly when I was a kid needing more therapy, and my insurance only covering 5 sessions, the military insurance, 5 sessions, that's all you get, and it may go on your record and it may track you forever, these kind of things, and thinking like, that's not the way that we need to do wellness and mental health. We need to make sure that we meet people where they are, that there's a network of support, and that it looks different for different people. And so that's why we created Caring for Denver. So we've given out $45 million worth of grants into the Denver community in a year. And we will continue to do that work. STAR is just one of those grants. Crisis intervention training was another, but so are programs like Make a Chess Move, where we're getting young folks to play chess in Black and brown communities primarily. And in that Make a Chess Move, they also are playing chess basically with a mental health therapist, a mental health practitioner, and just being able to start to talk about what's going on in the community. We also have funded a Therapists of Color collaborative, where folks who are experiencing trauma or who have experienced trauma can go and get at least 20 sessions per year for complete free, and then additional sessions as necessary. And so again, it's really important that we have that network and that comprehensive care. So I see a message from Sita. Why did Denver set up a nonprofit corporation, the Caring for Denver Foundation, to fund STAR rather than placing a program directly under city and county government? Absolutely. So this is really interesting. So I'm a legislator. I previously was the chair of the finance committee and the vice chair of judiciary. But I have worked in mental health policy. And what I was finding was we were paying for not funding mental health and substance misuse in the state budget under the Department of Corrections or the Department of Public Safety, and Human Services, especially around child welfare. And it was a disaster. It is a disaster. But getting Denver and getting the state to actually invest the funding needed to change the mental health infrastructure, it just was too daunting, and people were not willing to put in the resources that they needed. And so what I did was I took off my I'm a legislator hat and I put on my I am a citizen of Denver hat, and I can run ballot measures because we have the option to do that here. And I'm going to run a ballot measure, and I'm going to ask for 25 cents on a $100 sales tax increase to create a mental health and substance misuse foundation that will fund a new infrastructure for wellness in Colorado or in Denver. And that ballot measure, I did not have the support of the city initially. The ballot measure passed by 70% of the vote. It's called Caring for Denver. And specifically, we said that funding would not go into the city infrastructure because bureaucracy will just eat up the money, right? And it'll just all go away. And instead, it will go into the foundation. I also used to work in foundation, and we'll fund projects based on what we think will be innovative and really move the needle in our communities. And so we did that, and we created this model, and it is unique. It is not something that has existed in the past, though other measures in Denver now have been created. And because the city would not initially fund STAR, we came in as the initial funder. It took us, it was an initial grant for the pilot program of about $200,000, $270,000 about to pilot the program. Not much at all. Definitely the city would have had that money if they wanted to invest, but they chose not to. And so but they did help us in connections, obviously, with law enforcement, 911, and resources. So we funded STAR and in partnership with the city and with Mental Health Center of Denver and the Denver Police Department. And so now that it's been such a success, the city has come in and has committed millions of dollars into the program so that we can fund STAR throughout the entire city. Because right now, the initial program was just in city center, so that we can actually fund a complete STAR model. And so really excited to be able to do that. And sometimes bureaucracies just are not set up for innovation. And so that's why Caring for Denver exists. It's not only for STAR, but STAR is a program that has had great success. So thank you for your question. And I think you're back. Can you hear me okay?
I am back and I can hear you. Thank you so much. I apologize for our technical difficulties. So I have missed the last question, but I appreciate you grabbing them from the Q&A for us.
Yeah, no problem.
I'm going to kind of switch gears a little bit and ask about menstrual products in the prison system, which you were a great proponent of back in 2019. We know that mental health can be greatly affected by people not having their basic human needs. Can you talk a little bit about how you think that might have affected the mental health of the people who are incarcerated that we're now able to get those menstrual products?
Absolutely. Well, I think I spoke a little bit about my sister being incarcerated. So you can imagine the firsthand experience there. And, honestly, it was something that I didn't even know we could fix, but thinking about it, my sister worked while she was in prison for, about $1 a day, and then would have to buy a box of tampons or pads, which are $12 to $14, and really choose between calling her kids or buying these products. And it's just ridiculous. So as I started my work in the House and started being on the Judiciary Committee, I made it a point to visit prisons and jails across the state and other facilities and just ask people what they think they needed. And it was fascinating because in the women's system, mostly because my sister was never asked what she needed, right? But in the female system, it was like, we just want tampons, like we need tampons, we need pads, we need panty liners, and we need to stop being degraded. Women were being told, people who are menstruating were being told, that if they soiled their clothes, even though if they didn't have, that they couldn't actually buy or even use the commissary to get the products they needed, and they were reprimanded for it. And this was like humiliating behavior. And for those of us who menstruate, we know this feeling, right? We know the feeling of not having what we need, and how it really, even just in school, tears down our mental health. It dehumanized us, and literally people were trading sex for these products, and that is not okay. And actually, Orange is the New Black actually did a whole series on this too. And it just became this thing that was so commonly known, but not dealt with. And I haven't mentioned that my father is actually a correctional officer, retired at a men's facility. But I talked to him about this, and he's like, yeah, it makes no sense. We have access to toilet paper, but we don't have access to tampons. And even they have access to condoms, And so it's like, why can't we get people the services they need? And it's because people won't talk about it and they don't care. So I ran my first budget measure to fund tampons in prison. And thankfully, we have a lot of women who are serving in the House and the Senate, and they really pushed this bill through in a bipartisan way. And then we did the same for all facilities in the state that were state run. And then we also did another one for all jails. And then recently, we actually passed a bill to provide more products for our young people in schools, and to allow for a funding source for schools to utilize to make sure that we're providing these services and these products. And what we found was that young menstruating people were leaving school. They were feeling disconnected. They were getting bullied if they didn't have access to these products. And so it's a real issue. And it's so interesting because, one, people don't think of it as a real issue, but it really is. But two, it's so easy to solve. It's not expensive. There are a lot of folks who want to partner, and it's really accessible. And so we just have to put the money and funding behind it. It cost us $40,000 for the state to provide these products in state facilities. And our state prison budget is $1 billion. They had the money, they just chose not to do it. And so we were able to get that done. And now, talking with our new director at DOC, there's no problems. Denver had already been doing it. There's no problems. The schools are doing it. There are no problems. All of these conversations about people hanging themselves with tampon strings was just absurd and not real. And now we're just finding that, these things work. And quite frankly, I love the fact that I went back to the facilities and said, we provided these tampons, these products. They felt so empowered and so proud that they were able to get that done, that it just makes me think, wow, now like you could be engaged in society in this way. You can make positive changes for you and your peers. Take that to the outside and do that too. You can do good. And it's just been really, really inspiring. I think you're on mute.
That's really an incredible story. I do have another question, and if you already answered this while I was offline, please feel free to let me know. But you're on the board of Urban Peaks, which is Colorado's leading homeless and youth service agency, and they utilize trauma-informed care in their practices. How do you think that trauma-informed care practices can positively affect minority communities, such as LGBTQ+ youth?
Yeah. So I'm off the board now, but I served for about 8 years. Sorry. And then that's probably on our end. I probably need to update my bio. But actually the executive director is now on my board for Caring for Denver. So I'm still intimately involved in the work. And again, it all shapes my experience and why I do the work that I do. But I have seen it work at at Urban Peak, and I've seen these kids who are being thrown away. And how wrong it is. And knowing that if we just get them the right services, if we're just patient and we understand that people have to go through a journey, that we can actually help to change lives. And that's what Urban Peak does. It's not just about a temporary shelter. It's about having that true holistic and comprehensive support network that you need, that allows you to fail, but also allows you to grow from that experience, and then become truly self-sufficient, not just age out of a system. And so that's really what we focus on there. And as any of you all know who have kids, I don't have kids, but I am my mom's kid. Like we aren't just done with getting support from our adults or our parents or our family once we turn 18. That's just not how it works, you know? Continue to make mistakes, continue to need advice and guidance, and support. And so Urban Peak really does that. It provides that support, and I'm really proud of that organization. I'm proud to still be a strong supporter of it.
Thank you so much. And you know, we've talked a lot about the Caring for Denver and the whole ballot initiative behind that you really supported, and now you have a whole board for. We did get a question wondering about the finances and how that works. I'm not sure if you'd already answered that.
I answered a question about why it's a nonprofit. When it comes to the finances, I mean, we created it. How do you know the financial impact of your program? So, I see, great. So this one, so what we said was we could not supplant existing city resources. So things that were already being funded by the city must continue to be funded, because otherwise, again, the money would just be eaten up and gone. We have a whole staff, just like any other foundation, but we also have a big evaluation component where we have our in-house evaluators that go out and look at the efficacies of our programs. And so that's how we know if they work or don't work. And we also provide a ton of TA for our network to make sure that we are able to do the work that we want to do. I mean, we are really piloting some things that are innovative, that are different, you know, that are not part of any model. We're not just funding beds. And so we do have all of that built into what we're doing at Caring for Denver in our staff and in our approach as well. And then we've been working really to become a leader in philanthropy in Colorado so that we can help other philanthropies understand mental health funding and support and what we can do around that. And so our executive director is Lorez Meinhold. I am the I'm the board chair. And I'm just really proud of her leadership too. When I went to Eugene, it was with her. And we have been building this organization, this foundation from the ground up. And I'm just really proud of the work that she's done as well. So shout out to Lorez.
That's so fantastic. So you also worked on a bill which restored voting rights to over 11,000 Coloradans on parole. How does their ability to participate in the elections benefit both them and the democracy as a whole?
Absolutely. So it's similar to that, like this empowerment piece around tampons and facilities, you know, there's data that shows this. There's been a whole study that showed that when folks vote, they are more engaged in their society and less likely to commit crimes. It's very fascinating. And I never would have made that connection had that not been presented to me through the ACLU. And so it's kind of a no-brainer. And in Colorado, we already have felony voting. We really work to increase access to the ballot box in any way that we can. We have in-jail voting in Colorado for those who are sitting in jail pre-carceration, so they have not been convicted of a crime. You're still eligible to vote, but if you can't get to a polling place because you're incarcerated, you're behind bars, like you're not going to vote. So in Denver, we actually have in-jail voting, and so why not have parolee voting as well? If we're going to lean on the parolee system to help people transition back into society, their voting rights should be they should be refranchised. They should be allowed to have that access to the ballot, and that's what we've done. And we saw right when we allowed it, thousands of people who were on parole going and voting. And I thought that was just so empowering. Again, in a nonpartisan, bipartisan way. Like I heard from conservatives, I heard from independents, I heard from Democrats who were all, telling me about the bill and how they had found out about it and how they were going to vote. And it's really inspiring. And so I just think, having connection to community makes a difference, feeling like you have a responsibility to your community makes a difference. And we should allow people to vote who are part of our society and part of our communities. And so these folks are. And so basically in Colorado, we've said that if you're not incarcerated for a crime, not pre-incarceration, but incarcerated for a crime, behind bars, that you can vote. And so we're just making it as easy as possible for people to understand that they have a right to the ballot.
That is so fantastic, and really, opens up a lot of doors for people who've had just different experiences in their lives. We had a question. We had a question about what you've done in Colorado, and you previously talked about this a little bit, but to increase the number of providers of color, especially in the mental health space. Has there been any specific initiatives behind this?
Yeah, I mean, we've talked a lot about, making sure that we have access to care that is culturally competent, and that it's much easier for you to relate to someone who looks like you or has similar background as you, or who you aspire to be like, and that's just really hard when we don't have a lot of therapists of color. And so, yes, we are working on that by making sure that we are supporting and providing grants to those organizations that specifically are supporting, mental health professionals of color, that hire mental health professionals of color, that are mental health professionals of color collaboratives. And then also when we find groups and organizations that want to do work in our communities and don't have anyone of color on staff or as resources or as a therapist, that we kind of call that out and we say, what are you going to do to change the makeup of your staff, of your service providers, because right now it doesn't align with the people who you're trying to serve. It's interesting because we have to be careful that we don't perpetuate the white savior complex, while also valuing people who want to do work in our communities, And so it's a balance, and we try to be a resource to help balance that out. So we absolutely are working to increase that infrastructure and to make sure that we have more therapists of color, not siloed, but a part of the entire system.
Absolutely, and that cultural competence.
Well, I think funding peers is really important. And so we're doing some work around funding peers and not funding them at minimum wage, but actually funding them at a living wage in our community so that they understand their value in the system too.
Yes, that's great. And the cultural competence component is so important for all providers. We know that when looking at mental health. And kind of leading into that, you were a prime sponsor of the Crown Act, which protects against discrimination based on hair texture and type, and protective hairstyles commonly associated with race. We have some similar bills that have been introduced here in Wisconsin along those lines. And can you talk a little bit more about this and why this anti-discrimination law was so important?
Yeah, again, personal experience, right? Like when I was young, I was a cheerleader, and I was, often told that if I couldn't get my hair straight or to look a certain way, that I was not appropriate for the squad or life or in general, and it's just really, again, humiliating, but also one that teaches self-hate, and so when I heard about a young cheerleader in Denver facing the same discrimination, when I saw the young man was a wrestler in Texas, I believe, have his dreadlocks cut off in the middle of a meet, it just hurt me, it hurt me. And then to realize, again, I'm a legislator, I could do something about this. I don't know why the law is not the way already. I mean, you would seem to understand that hair discrimination is discrimination, but it's so built in our society that if you have an afro or dreadlocks or twists like I have now, that it's not professional or it's less than appealing or attractive or sellable. And that's just not true. And it's something that we have to unlearn as a society. And the courts had initially ruled that hair discrimination was not racial discrimination. And unless we had a specific bill and law that said it was, then it wouldn't be treated as such. And so that's why we became one of the first 5 states to pass the Crown Act. I didn't know what the Crown Act was I just knew that I wanted to ban this type of discrimination in schools, in the workplace, and even in housing, because we were finding it discrimination in housing. And then I got a call from the Crown Coalition letting me know about their work, providing their resources. And also shout out to Oprah and Dove, who really who are pushing the coalition now. And of course, when I found out Oprah was involved and that I was going to get to meet her, I was like, we're in. But we definitely have the support in Colorado. Once you kind of tell those personal stories, you realize how big of a problem it is, even if it doesn't affect that person directly. When they realize how it affects people of color, men, women, gender non-binary, of all races. I mean, we heard such stories from Native American boys and men who were just told that they couldn't wear their hair long. I mean, just those kind of things that really we realized that was not who we were as a state anymore, and that we needed to change the law, and we did. And the testimony really did change the votes of some of my colleagues right in the moment. And so that was really beautiful to see. But this should be a national law. I mean, this is discrimination. We've called it such, we've seen it as such now, and it's just time to change.
That's really, really incredible. And I just had a question come in about how we can affect the change of stigma against mental illness in communities of color. I know you talked a little bit about that in the beginning, but could you elaborate on that a little bit for us?
We've got to have more therapists of color. So we need to do more loans and loan forgiveness. Loan forgiveness and grants and support. Absolutely. Scholarships to get more folks in. The stigma is there because we have had bad outcomes from mental health professionals and medical professionals who are not a part of our communities doing work in our communities. You know, we have seen the negative impacts that has. There is a lack of trust, and there is, you know, a lack of sharing in the traditional European way about what mental health care and what a response to mental health care is. But we do have needs, right? I mean, the war on drugs specifically targeted us. There is a lot of, you know, challenges that we've had through mass incarceration and trauma that we have to address. And quite frankly, our resilience is beautiful as a community. It does not mean that we don't need more support. And it doesn't mean that we should always have to be the strong Black woman or the strong whatever in order to live, you know, and survive. And so we're working to break down that stigma. And I gotta say, the reason we passed Caring for Denver with 70% of the vote was because of the work of folks like NAMI and others who are breaking down that stigma everywhere you go. It is okay to talk about mental health needs. It is okay to need help. It is okay to support your friend, your family, yourself. It is okay to ask for that help. That is something that is a conversation that has shifted over, I think, this past 10 years. That is because of the people who are doing that work, like you all. And we're finding that happening in Black communities as well, communities of color as well, BIPOC communities. And it's just something that we have to continue to do. And it's working. It's working. You know, I definitely have way more conversations with my friends now about, you know, are you going to therapy this month or this cycle? Like, are you in therapy? Like, what is that looking like? Talk to me about your therapist and what kind, and like all this. It becomes like this normal conversation, you know, as much as, you know, how you're doing your hair this week or what shoes you're wearing. And I think that is really empowering. And then also, you know, one of my friends just really inspired me the other day by saying, you know, my daughter came up to me and said, "Mom, I like boys, but I think I like girls too. And I want to have a conversation about that." And Mom was equipped because of, you know, her journey through her trauma and through her, you know, mental health journey to say, like, this is how I'm going to respond. And I'm going to embrace my daughter. I'm going to talk about my fears and I'm going to ask her what she needs, you know, and that is just so beautiful. And so we just see it impacting us in so many different ways than we even thought of. You know, I don't think that my friend went through her therapy journey and is going through her journey because she thought her daughter was going to come out to her and wanted to respond better, you know? No, that's not why she went there. But as she did, you know, she learned how to be more open, more caring, less defensive, and talk about what she was afraid of. And then have that conversation with us, her friends, you know? So that's just been inspiring to see these conversations happening in the communities in such different ways. And then seeing her daughter step up and say what she needs, but also thinking about how she's going to help support her friends who do not have supportive parents like her. And so anyways, that's like a long story to just say that it's changing. And I think it's because of folks who are having the conversation. So I thank you all for being advocates, and for not like stepping back and always stepping into these really tough conversations around what our community needs. So thank you.
Well, thank you. And speaking about language, we did have a question that came in about language around law enforcement and, calling them safety officers. What are your feelings and around the way that we speak about law enforcement currently?
Yeah, my father was law enforcement. As I said, he was a correctional officer. And I even, I still say cops. Have said guards at times, and, that's not appropriate to say. So, I do try to watch my language. When it comes to how people self-identify, it's really interesting, right? Because you think about law enforcement or cops or however you want to say that, that's one thing. And I think we have to try to be mindful of that. When it comes to the framework of public safety and thinking that law enforcement is the only way to ensure that our communities are safe, it's wrong. And that label is wrong. It's what we still use today, but I hear the pushback and I completely get it. And I think it's dead on. Like that's not just public safety, and incarceration is not just public safety. And there's so much that we need to do to shift the way that we think about that. STAR does help to shift that. Co-responders do help to shift that, even within law enforcement's thinking of what safety truly means. But it's got to be a whole societal approach because we're not doing it. We're not getting it right. So I appreciate that distinction, and I appreciate the resources that were also shared in the chat box.
And how would you recommend that both constituents and legislators advocate for similar legislation in Wisconsin that we've talked about today?
Well, definitely start to, have the conversations with your elected officials, both at the local level and at the state level, and just see what we can do to incentivize these types of programs and models. So we did actually pass a bill this past year at the state level that funded these pilot programs, because everyone doesn't have a Caring for Denver, and they want it now, which is great because they were not wanting it before. And so we passed, I think, $5 million into a pot of money so that local agencies can start things like STAR, both nonprofit, community-wide mental health substance use agencies and law enforcement partnering can really look at how they're triaging, how they're responding to trauma and needs in the community. So we did do that at the state level. It was bipartisanly supported. And so just thinking, and federal stimulus dollars can be used for these efforts. And all states have these Fed STEM dollars. So have that conversation. Look at our law. I think it was House Bill 1035. It was run by Representative McCluskey, Representative McKean, and I was the co-sponsor. To look at those kind of bills, like how can you do the carrot and stick approach when it comes to looking at mental health and substance misuse? This is something that I do believe we can pass across the country in varying communities. I mean, Eugene looks very different than Denver, but it's working here, it's working there, and it's expanding across the country. And so encourage them to look at their federal STEM dollars, encourage them to create a pot of money that then your locals can go and ask for funding. Yes.
What an incredible answer. Thank you so much. Unfortunately, that's all the time that we have today for our event. But I want to thank Representative Herod for joining us today and for all of your hard work to improve the lives of those in your community. I apologize to everyone for our technical difficulties we had earlier, and if we missed any questions because of that.
Thank you so much. Thanks, everyone. Feel free to follow me on Instagram, Facebook, and Twitter. I'll be happy to answer any questions that I can or point you in the right direction. I look forward to doing this work and seeing all of the things that Wisconsin will do because of your involvement. So thank you and have a great day.